What we're going to look at now is what to expect in the coming months. And this is the section where right after you get done writing the outline, some of your predictions became true and others became worse and better. It's a very, very fluid situation. You just need an ongoing review of your state, county, and city orders, keeping in mind CDPH provides you most of the guidance in the state. Typically, healthcare operations are always defined as essential. Earlier on, not anything that could be deferred, the idea was defer. That has loosened up substantially because you can't defer a lot of treatment now coming up on 6 months. So healthcare operations are typically always defined in the essential category, and so you'll be free to keep working. If, as we've said already, if you can have more done via telehealth, more done via employees at home, great, go ahead and do it. If you can't, it is basically time to get back. You will to work, and you will need to keep up with what the locals are saying. On that, face covering orders have been in the news a fair amount, and you can see these at all different levels. Interestingly, in LA County, for example, largest county, the city of Los Angeles had an order that was not exactly matching the county of Los Angeles. Specifically, it didn't when it came to healthcare providers. So the rule of thumb there is go with the most strict rule of the various jurisdictions that you find yourself in. Almost everybody is in state, county, and a city. Some are just state and county, but go with the strictest rule you can find. Of course, the goal here is to keep the patient safe, but also to keep the employees safe. And generally at this point, anything being indoors in a healthcare setting, you're going to need the patient's mask with the cloth or homemade option, and your staff with a higher grade mask. A lot of the exemptions that you see in both the state and local orders don't impact the healthcare practices, which are generally very broadly defined. At the same time, you want to make sure you're not going overly beyond what the recommendations are for most businesses, because it could lead to lawsuits with employees down the road, possibly with your licensing board as well. Stay-at-home order. What we originally said was the patient's perception is usually 2 weeks behind reality statistically and from the news media. What I would recommend to you is looking pretty regularly at the CDPH reporting numbers and then taking that down to your county and possibly even your city level. That's all online. You read in the newspaper a spike in something or other almost every single day. That can be caused by a number of things. There could be an actual spike. There could be a lot more testing, or one of the things we're seeing a lot of right now is there's a reporting lag. So you see a quote unquote spike in deaths in some state or in some county, but when you go down to the actual data, the deaths are reported. They all dump into the system on a certain day, but the deaths themselves may have occurred weeks earlier because there's a lot of lag in the reporting system. So you want to be informing your patient's perception. You want to be letting them know that you're ready to see them and that you're safe, and then in fact it's time to get back in to the office and be armed with the data for your local area. So look at your county numbers on a regular basis, see where things are going, and also you can take a look at is there much lag in the reporting time. You will find patients are always behind the times on the actual county data compared to maybe what they're picking up from friends, family, or media headlines, as opposed to the actual current state of things. So the stay-at-home order it's modified and then it's brought back as we move to the next section. That's something the governor has referred to as toggle. switching. We saw a bit of that just even with the last week. The governor has been fairly consistent, and counties, and we also see the mayor of Los Angeles talking in these terms too. Local leaders are clear that just because it gets going in the right direction doesn't mean they're not reserving the right to bring it back. And so it is not going to be a one and done, the order's lifted and away we go. Things might get more restrictive. Things did get more restrictive last week for a number of businesses, not so much in the healthcare setting, but we did experience our first toggle in the backwards direction, and hopefully it toggles forward in the coming days or weeks. What they're looking at when they're modifying the order are a number of factors. There are really, when your county is on the watch lists, as most are right now, there are a couple of, there are really 5 factors, 3 of which have to do with your hospitalization capacity, equipment, ICU, and beds, and so forth. The others have to do with your testing percentages. They're looking for a positive test to be 8% or lower, and also your overall positive infections per 100,000 residents. They're looking for that number to be below 100, or if you have testing above 8% positive, then your 100,000 needs to be 25 infected per 100,000 citizens. So those 5 factors are what keep your county on or off the watch list. If you're on the watch list, then your restrictions go up. If you're not, they go down. Really, the only ones not on the watch list right now are on the far eastern and northern ends of the state. So there are the factors there. Through this summer and beyond, where are we going? What are some predictions? We've already seen HIPAA relaxation issues. That doesn't mean it's totally gone. Don't get too footloose and fancy-free with HIPAA, especially with disclosing it to employers and the like. However, things done in good faith right now, but accidental disclosures have less enforcement consequences than they would have before this. We've also seen improvement with respect to regulations affecting Stark Law and some of Medicare and reimbursement issues. In addition, and connected to that, is relaxed rules for telehealth and so forth. As I mentioned earlier, there haven't been significant changes with respect to OSHA or the employment and labor laws in California. And so, meal and rest breaks are still meal and rest breaks. They still need to be taken, even if you're extending the hours of your practice so you can decrease the amount of people in the office at any one time. Maybe you've extended the hours of operation. That's going to impact how you do meal and rest breaks. And then last, but certainly not least, I started this when I did the presentation for other groups earlier in the late spring and early summer, said I'm anticipating enforcement actions. And now Jehan and I already have 2 from various licensing boards. The issues you need to be thinking about there could come up in the advertising context, saying things that can't be demonstrated with respect to treatment of cure of COVID and the like. And one that I guess surprised me that we got, but maybe it shouldn't have surprised me, is that a patient or employee, unknown to me at this point, made a complaint to a licensing board that the doctor was not requiring face masks rigorously in the office. And so that has launched an enforcement action on the face mask issue. So the enforcement actions are already starting from the licensing board. You need to be aware of that. Down the road, I would anticipate, because of some of the changes in reimbursement on COVID issues, I would anticipate either federal payer or private payer audits and recoupment actions. So monitor your record keeping and your billing accordingly. Just somebody out there is gonna get audited. I am quite sure. So that's what I would predict is coming up for the rest of the summer and beyond in that area, along with that we're just going to still be nimble because this thing isn't going away as quickly as everyone hoped. So you can anticipate more federal laws. You can anticipate more orders and guidance from CDPH at the state level, and you're just going to have to keep attuned to things. So with that, let's open it up for a round of questions, if there are any.
One question I did receive is in regards to non-compliant patients who may come in without masks or any kind of protections. Is there anything to be considered in that scenario? I know everybody's a little freaked out seeing the social media stuff floating around.
Yeah, no, it's a good question. I would have masks available for a patient who forgot them, and you have every right to not admit them if they won't wear them. Now, there are some exceptions. You're the doctor, you should know about them, for people who can't wear masks for underlying condition, whether it is mental or physical. And so in that category, I would recommend not patient abandonment necessarily at all there, but dealing with it more in the context that we talked about if you were dealing with someone who's COVID positive, and so you have more isolation, no waiting room time, kind of straight from the car to the room, and having the staff fully with full PPE when interacting with the patient, even in like the billing context. So if you have an exception patient who can't wear the mask, we'll deal with one. If they don't have that exception, require them to wear the mask.